Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference May 20th through 22nd, 2011. The inaugural event is being sponsored by Massage Today, Massage Envy, Massage Warehouse, and ABMP, and will be held in beautiful Atlanta, Georgia. Our special guest today is Anita Shannon. Anita and I will be talking about her class at the American Massage Conference, MediCupping produces radical results for cellulite, solid bloat, and wellness. But before we get started, I'd like to tell you a little bit about Anita. Anita Shannon has been a licensed massage therapist and a licensed cosmetologist since 1983. She has been a national educator since 1990, appearing at numerous national spa and massage conventions each year, and has presented numerous workshops on ACE massage cupping and MediCupping since developing these brands of bodywork in 2002. Anita is also the Director of Advanced Continuing Education and an NCB TMB CE provider. Anita has published articles in Massage Today, Massage Magazine, and Les Nouvelles Esthétiques, as well as a number of educational videos, and is currently working on a book, Vacuum Therapies. Her newest efforts include the Pink Cup Project for Breast Health and Cancer Recovery and TheraCupping Home Care Products and Education. Anita, welcome to the American Massage Conference pre-conference broadcast series. It's great to have the opportunity to talk with you today about your class, MediCupping produces radical results for cellulite, solid bloat, and wellness.
Well, thanks, Felicia. I'm real excited to be here and also to be part of the American Massage Conference and this pre-conference broadcast series.
Well, we're excited to talk to you today and have you on the program. And before we get into your topic, I'd like to find out, Anita, why exactly did you want to be involved with the American Massage Conference in Atlanta?
Well, who wouldn't, actually? Knowing you guys for years and watching everything you've done, with Massage Therapy Radio, and then finally getting to participate in the Canadian Massage Conference last year, getting to participate in the World Massage Conference with you guys a couple years ago, you're just doing some very cutting-edge work, and the show in Canada was just one of the best I've done in a long time. It just was really a treat. So, yes, definitely wanted to be here in Atlanta.
Well, Scott and his whole team, Robin, Lorna, Monica, and, of course, Angie Patrick, added into the mix for the American Massage Conference. They have just done an amazing job putting this together, and I know it's going to be a great event. So, like you, I just had to be a part of it. Anita, is there any... Go ahead.
No, I was going to say, we're going to have a lot of fun, too. That's the neat thing is the show is really serious, offers a lot of education, a lot of great vendors, but, looking forward to the gala event and interested in what the forum topic is going to be.
It is going to be a lot of fun, I agree. The gala is going to be a wonderful event, and I know that, like you as an educator, sometimes we might even find it hard to get into some of those classes because we're so busy teaching and talking with students, but there's so many great opportunities at this conference to network and get to know people and lots of fun social events. I know we're going to have a great time. Well, tell me, Anita, I want to get into your topic because it's really something I don't know much about, and so I'm really excited to learn about your class in Atlanta. So I'd like to just start by asking you to tell everybody what MediCupping is and how you got started with this modality.
Well, MediCupping is a vacuum therapy technique, and it uses a machine. It's based on the foundation of massage cupping that we developed. It's a very specific set of movements, very specific evaluation criteria. This we developed as a stepping stone to working with the medical community, and they have just embraced it in a big way. When we started out with the manual equipment, we tried showing, what we could do, but when they saw our cups and guns, they just kind of laughed at us. So when we came in with a machine, then we could show them the same results, but all of a sudden we were taken very seriously. And also after you work with the manual sets for a while, it's really nice to go to a machine. It gives you a lot more latitude. It gives you your other hand back. So it gives practitioners an opportunity to really step up with a modality that we end up using on almost everybody on our table.
Wow. And so how did you get started doing that?
Well, I started out as an assistant in an acupuncture clinic, and they threw cups at me and literally told me how to do it, and I did all my work based on their instructions, based on their diagnoses. And I started noticing something very different, that all of a sudden the tissue was changing texture very quickly, things were releasing, and that there was something really special about this that was not a part of body work yet. So I took it and started using it within the confines of our licensing and really using it more for body work and no Chinese medicine included. So it started from there, and the more we spread it and the more people started reporting back on what was happening, the more we spread it.
I see. That's pretty interesting. I know I've had cupping done before, just once for an injury, but it was very effective, so I can see how if you found those results happening with the patients and clients you were treating, that you would want to do it as a bodywork method. Can you tell me, is there any particular reason why people are getting interested in vacuum therapy again?
Yes, it's adding a whole new dimension to our bodywork, especially for those of us who have been doing this for 20-some years. You do wear out as the tool. So having something come in that alleviates the stress, it's a smarter, not harder mentality. And it also creates space in the tissue that we can't do with our hand techniques. So it adds a whole new dimension there. And it also really addresses, it's a very strange thing, it is used to really erase history. Some of the old injuries that we're picking up in people, everything from epidural insertions from when they had children 30 years ago that have now created restrictions, to old sprained ankles, old injuries, even through birth. It's just an amazing technique that the more we work with it, the more it shows us. And the prevention thing, that's why we put wellness in the title of our class. Yes, we can treat injury. We're very trained to do that. But now as body workers, it's time to really step in and look at some conditions that are really presenting themselves to our eyes and erasing everything up to that point that created it. We can actually work on people with asthma and get amazing results, sometimes actually pulling old smoke out of them from when they were kids and their parents smoked. It's amazing. It just is mind-blowing to work with it.
Well, you're blowing my mind right now as you're talking about it, thinking, wow, I don't know how I'm going to have enough time to receive all the techniques I'm now interested in that are happening at the conference. Because I'm thinking, wow, I've got to get Anita to work on me. This is amazing.
Well, that's the reason we set up a booth. It's not to sell equipment. It's to, show people the technique, get people on the table so they really feel it and understand it. Because until you feel it, you don't have the full picture. And then we really like to promote workshops and really inspire people to get training. Don't just go out and buy equipment and start sucking on people. You can really hurt people. And also, it requires some knowledge of the lymphatic system, and this whole concept of solid bloat is a big component of what we do.
Well, can you explain that term, solid bloat, and how it relates to bodywork in general?
Yes, I think when people really get to understand this, they're going to see it in a lot of their clients. It's resulting from this innate dehydration and severe heat and inflammation that people have in their tissues from diet, lifestyle, stress, chemicals around us, everything. And what's happening is it's cooking all of the water out of our tissues and out of the lymph. So what happens is people get this layering over them, and it also permeates the tissues and the fascia. So it turns into this cement-like layer, and people think they're fat, and they're actually not. We have people, in 2 days of a workshop holding their pants out from themselves about 3-4 inches.
Wow.
it's creating the conditions, too, that lead to further disease. This creates an acid pH. It creates a positive charge in the tissue that leaves people open to immune system issues, to cancer, to things like that. And we're finding that as we erase this, if we move this solid bloat, open the tissues up to receive fluid again, and we use that heat from the tissues to move the bloat, that's what we use to liquefy it. So it's fascinating, and it really, people who have muscular issues, things like that, don't realize that even, their trapezius is full of this and wonder why they have a frozen shoulder. It's fascinating.
Well, I'll tell you, as a massage therapist for 17 years, I've encountered a number of people, myself included, with that cement-like muscle tissue that seems almost impossible to have an effect on. And you almost sometimes feel like you're at a loss of what else to do for that, if you can even get through it, to feel like you've made a difference at all. You're doing well. So I'm curious how the vacuum therapy addresses this issue. It sounds like it's helping to separate and create space, but is there more to it?
Yes, it affects the lymphatic system in a big way. Not only, you can work very superficially with it, we tend to go a little deeper into the intermediate lymphatic system, and in that way, when we open that space up between the dermis and the epidermis where lymph flows, most of that has been sealed shut by the heat. It's fascial adhesions, it's tissue adhesions. And as you move the cup over, you're going to see these dents and divots where all of this tissue is fused. So you really see a lot through the cup. What we do is use the vacuum to open that back up, create vasodilation to liquefy what is there, basically suck all of this up out of the tissues and move it in a safe manner to where it needs to go. So body contouring is incredible, but we also use this for fibromyalgia with great success. And by eliminating the solid bloat that people with that condition have built up and opening their lymphatic system so it functions again, our main goal is what we all started in bodywork for, to facilitate homeostatic balance in our clients so that their bodies stay balanced and take over. So if we erase all of the adhesions, the fusions, everything, and open their lymphatic system up to like it was when they were 10, that's a great thing at 50 years old. That's a real gift.
Oh, it definitely is. I'm fantasizing about having all of my tissues sucked on right now. I'm thinking, wow, I never really thought I would be interested in this. And as someone who gets a lot of massage, I'm curious, is there a way that standard massage can affect this same kind of condition, this solid bloat?
Not that we found yet. The only way to create vasodilation is to add heat. The only other way is a vacuum therapy that opens the vessels up. So that it makes it difficult. That's why we tell people, add this into your massage. People come to us for our hands, but when you encounter an area that's restricted, where there's scar tissue, where there's dehydration, pull out the cup and, suck it up. And now you can go back in and actually accomplish something, because you aren't fighting this residue that's been in there for anywhere from 5 to 40 years in some people. Right.
Well, I can tell just from talking with you a little bit, your class is probably a lot of fun.
We a lot of bad jokes.
I guess so. I can see myself just saying all the bad jokes too. So I'll try to withhold right now while we're in this public forum. But I imagine it gets pretty funny in the classroom. So when we have fun. We keep it very professional with our clients, but when we're in class, it is a good laugh. Yeah,
there's all kinds of funny noises that come out of the cups too, so we do laugh a lot. I think this past weekend I did a class in South Carolina, and the class next door complained because we were laughing too much.
That's funny. That's really funny. I'm curious. Well, you just said something about integrating this or using it with a client and then going back in manually with your hand. So it doesn't sound like a client is going to come in and have an hour of cupping, of MediCupping. It's more something that you integrate into a regular session. Am I correct on that?
Everybody uses it differently. That's the beauty of it. It's just like massage. My husband does very short, spot treatments. He works with a lot of surgeons and physicians here in Asheville. I do full body treatments, and when I can work on people, specialize in pre and post bariatric surgery. So I've got to treat the whole person, and they do get a full session of just the vacuum work. Now, when I'm doing regular massage work and, somebody's come to me because of a knee issue or, something with their back, I still do my regular hand work. And then I even incorporate it. If somebody knows trigger points, you can use the cups for that. If you know any different, fascial release techniques, incorporate the cups into it. So it's really malleable. The only thing that we ask is that you keep within licensing and what we've shown you, and, not step outside of the boundaries of massage.
I see. I gotcha. Well, it sounds like it's just something you can add into a lot.
Right. It does anything. It's just one of the most versatile tools I've ever come across, and you can do anything from the MediCupping machines down to these, great little silicone cups that you squeeze by hand. It's whatever anybody wants and what they want to add in.
That's excellent. Well, I'm curious if there's any particular kind of setting in which this type of modality is most suitable for.
Medical clinics and PTs are starting to look at it. One of the hospitals here is asking us to come in on their oncology ward. We have private practitioners in their own offices using it. We've trained Canyon Ranch. We just trained the Sasanqua Spa down in Kiowa. So it really does flow into every setting quite easily, and adapts to the practitioner. Once they learn the basics of it, they can run with it just like massage. It's the only thing that we stress. The biggest thing we stress, though, is that if you're doing stationary placement of cups, in body work, that is contraindicated if you're leaving it sit like 10, 15 minutes. In body work, that gathers congestion, where what we want to do is disperse it. So we do ask people, if you're going to do the Chinese placement and leave them sit for 15 minutes, that you understand, what you're doing with that.
Well, I'm sure you talk about some of that in your class so that people have an idea of what's proper and what the right amount of time is. They're not playing a guessing game at that.
Right. It's pretty. We're very thorough, and the DVDs are really thorough. We wanted you to know everything we've come up with so far.
That's excellent. You've mentioned a number of different conditions, but I just want to go over that again. Is there anyone or any particular type of condition or any particular type of client that would be most likely to get this kind of work?
We work a lot with people with diabetes. We're real successful with neuropathic conditions. I do enjoy working a lot with Parkinson's. One of my favorites, though, is fibromyalgia, because I know we can help people get to a point of being asymptomatic, me being one of them, so I maintain myself. Plantar fasciitis, we found that this has broken down bone spurs. We've got some nurses working with that. It surprises us at every turn. So what we give everybody is a list of evaluation criteria based on what this does, and they assess the person with their specific conditions as to how they address it. So almost every condition falls under that. You just have to be very careful working with cancer patients, especially if they're receiving radiation. That's pretty well contraindicated to work with.
So if they're in active treatment, then this probably isn't a good fit for them.
Yes, it pulls heat out of the tissues. That's not something you would want to do, but as you learn from us, you would know that. If not, we always really stress to people, any question, go back to the primary care practitioner and get permission to work on that person.
Absolutely. I think that's important for anybody that's going through some sort of large crisis, medical crisis, whether cancer or any of the other conditions that you talked about, to just double check with the physician and make sure that that it's okay. There's not any sort of a contraindication or something that would be disruptive to the treatment that the physician's offering.
Right, and you should see what we can do for post-mastectomy patients. We've got these huge cups that are shaped like Madonna, breast cones, but we put them over the scarring. We've been able to lift the scars off the rib cage and treat something that we call phantom breast syndrome just by the pumping movement. It's helped some women really overcome some of the emotional difficulties. And I don't think that people have addressed or thought of the fact that it's just like phantom limb syndrome. There is a phantom breast syndrome. And it's amazing to watch, these women make a big turnaround, but also be able to breathe again because the scarring has lifted and given them some freedom in the rib cage again. It's just a really neat thing to work with for us. That's a big part of the Pink Cup project.
That sounds amazing. It sounds like really that the possibilities of what this can do are really seemingly endless, and that it could be a benefit to so many practitioners in adding things to their practice and helping their patients in a new way. But obviously it can help with so many conditions. It can really help people feel better in numerous ways. I'm still astounded what you were saying about the asthma and the smoke that people may have been around as a child.
They're pretty freaked out when they see the gray coming up in the skin in their back. And my favorite person lately, though, is a fellow who was burned severely as a child and developed really bad keloid tissue. And he's one of the CEOs at this big golf club, and he's never been able to play in his life. He can't even bend forward. So he came in when I did a class down there and offered himself, just to test this and see what it could really do. And 2 days later, he was running around, showing everybody that he could finally, for the first time, bend forward about 10 degrees. And he's 62. And he was showing them how he could raise his arm. He gained almost, 25 degrees in range of motion.
Wow.
And that brings tears to your eyes, somebody who might finally be able to play golf on his own course,
No doubt. The change in the restriction of movement and range of motion, that's amazing.
Yeah, see, just really special cases come like that we have the tools to deal with now, cups that are big enough for a massive body burn like that, and, the gentleness of the machine in loosening it for him. So it's just very touching a lot of the times.
It sounds like it. Well, I'm really excited to learn more about it, and I hope you're going to put me first on your list to receive a session in your booth. I definitely want to take advantage of that. Before we wrap up, Anita, I want to ask you: is there any other advice or guidance that you would give to people who haven't experienced the massage cupping or MediCupping or any of these vacuum therapies, or perhaps for the therapists that are interested in receiving it? Any special words of advice for them?
Yeah, take a really good look at it. A lot of people still think it's the Chinese cupping technique. Really look at this as vacuum therapies, and don't even think cupping at this point. That we do use cups, and that's why we keep the term, but it really is something unusual, and just come to one of the shows and try it. If you do decide to get trained, realize that you aren't going to walk out of the class ready to really start on people, that you do need some practice with it. It's a very unusual tool to add. So practice after you learn it, and don't schedule your clients the day after class.
That's some good advice. I'm sure people will be at home cupping their pets and their family members and doing work on themselves to try and get practice.
It's a lot of fun to treat your family. A lot of people have actually bought a couple sets of equipment, just to have one at home for when things come up.
I'm sure. I can totally see myself doing it the same way. I know that everybody listening is going to want to come to your class, but there's some people that aren't going to be able to make it just for having to choose between yours and some other class that they're interested in, or not being able to come to the conference in Atlanta. How can people learn more about you and the other classes that you offer?
Well, you can visit our website. The main website is massagecupping.com. We also have a directional site called cuppingtherapy.com, and that will direct you to the Pink Cup Project, to MediCupping.com, to TheraCupping.com, and you'll see some of the home care equipment. So we have a multitude of sites and actually quite a few more coming out.
Well, great. Well, I know that people are going to want to check those out, so thanks for sharing them, and I really appreciate all of the information that you've had. Stick around for just a minute. Right now, what I want to do is make sure that everyone knows how to come to the conference and to be a part of Anita's class. Of course, we want to invite everyone that's listening today to be a part of the first American Massage Conference that's been put together by Scott Dartnell and his wonderful team, Monica, Lorna, Angie, and Robin. They have done an amazing job to create an affordable, fun, education-packed conference for you. Only $40 to register, and it will get you access to 25 free one-hour CE classes. This $40 registration also gets you access to the trade show, where there will be top massage product and equipment manufacturers and vendors, and you will automatically be entered into a drawing for thousands of dollars worth of door prizes. Like Anita and me, who've been in Canada and seen the stash that these guys are going to have on hand, we can tell you for a fact that that $40 registration is worth just being a part of the raffle and having a chance to win these great door prizes. But wait, there's more. We're also in Atlanta having the first ever National Massage Therapy Job Fair. This is going to be on Sunday the 22nd from 1 until 5 p.m. And this is not just for people who live in Atlanta. This is a national job fair, and there will be national, state, and local employers on hand. So bring your resume, be ready to talk to a few people. You could potentially walk away from this conference with a new job. And for any employers who are interested in participating, we would love for you to contact us through the Job Fair tab at www.americanmassageconference.com. In addition, we will have over 100 hours of CE available from a variety of instructors, including Anita, through 3-hour, full-day, and 2-day workshops that you can also register for. For students, we have a free student day that includes the Smart from the Start presentation, and there are still spaces available in this at the present time. Of course, we are also going to be offering a free full-day class on passing the MBLEX and NCB certification exams. This is with Laura Allen, and it's sponsored by ABMP. For the first 70 people that come to the class, they will also receive a free copy of Laura's book about the same topic that's been generously donated by Lippincott, her publisher. All attendees at the conference are invited to come to the Saturday night gala with food, drinks, and live entertainment. Space is limited here, though, so please be sure to get your tickets for this event when you register for the conference. As I said, this is a very affordable conference, including the hotel. If you can at all possibly stay on site at the conference hotel, you're going to want to do that. Rates are only $121 a night. Whether you choose to stay in the room by yourself or split it with up to 3 people, it's an affordable price that you just don't want to miss out on. And as a reminder to everyone, take a look at the May issue of Massage Today. The show guide is going to be in the center spread of that issue and is going out to over 62,000 massage therapists and will also be available free at the show. This is the first ever nationally circulated conference show guide, and you'll want to pick up your copy so you can see exactly what's going on at the conference each and every day. Of course, the American Massage Conference could not happen without the support of all of our global sponsors, including Massage Envy, Massage Warehouse, ABMP, and of course Massage Today. We thank all of them for their support in this year's event. So, do you want to come to the conference yet? I'll bet you do. If you are ready to register for the American Massage Conference, May 20th through 22nd in Atlanta, Georgia, and meet Anita, as well as attend classes of the other amazing presenters at this year's event, there are 2 ways to do so now. First, you can register and pick your courses by phone. Just call this wonderful toll-free number. Operators are waiting to talk to you. That number is 877-788-3655. 877-788-3078. I'll say it again so you can write it down, 877-788-3078. But if you prefer to register online, then you can visit the official conference website at www.americanmassageconference.com. And, of course, we invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. I hope after today's discussion and, gosh, such an interesting interview with Anita Shannon, that everyone listening is ready to come to Atlanta and take her class, MediCupping Produces Radical Results for Cellulite, Solid Bloat, and Wellness. Anita, thank you so much for taking the time to be with us today and for sharing your time and knowledge about this topic. We're really looking forward to your class at the American Massage Conference, and I'm looking forward to getting a treatment in the booth.
Great. We look forward to having you there, and we sure look forward to seeing everybody in Atlanta.
Thanks again, Anita. Everyone, this is Felicia Brown, and on behalf of everybody from the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing you in Atlanta in May. Thanks again for tuning in, and have a fabulous day.
Come again.
Let there be plenty. Let there be plenty love. Let there be